Well, good morning. Thanks for joining us this morning for our One Sioux Falls media briefing. I'm going to kick things off this morning, and then you're going to be hearing from SDSU President Barry Dunn to talk about the Metro Center project here in Sioux Falls. And I wanted to open it up because this is a great project in our community for multiple reasons that I'd like to share with you all. First off, SDSU has been just a real great partner for the city of Sioux Falls for many years. You may not know this, but President Dunn and I, along with now Councilor Brown and I, we've met for many years on a quarterly basis in my office just to talk about what connections we can have with SDSU to further take advantage of, the hundreds and hundreds of graduates that they turn out every year to fill the workforce gaps that we have in Sioux Falls, whether that be in engineering or healthcare or even in ag science or whatever it might be. And so projects like SDSU Connect, projects like Startup Sioux Falls and the Ness School of Business and Economics, there's been multiple partnerships that have been successful for us here in Sioux Falls. And we're going to talk about another one of those today, and that revolves around our healthcare industry. Our healthcare industry here in Sioux Falls is our strongest industry in terms of our economic impact, also in terms of our employment base. When you look at Sanford, Avera, and our VA, healthcare is our #1 employer here in Sioux Falls. We attract people from all over the region, all over the upper Midwest, in some cases all over the country because of the quality of our healthcare here in Sioux Falls, South Dakota. And again, the economic impact of our healthcare here in Sioux Falls can't be overstated. It returns billions of dollars to the state every year. And so we want to talk a little bit today about the educational institutions here in our state and the fantastic job they're doing to make sure that we're filling the workforce gaps that exist to keep that economic engine in healthcare rolling. One of those, most recently, the USD Medical School, they announced they're going to be moving that school to Sioux Falls here in the years ahead. I think that's a wise move, as do they, to be closer to where the clinicals can happen, to where some of the on-site training can be happening for those med school students. We've had several partnerships with Southeast Tech over the years for some of those Surge Tech and Rad Tech programs, things like that, to fill some of the jobs we need in our healthcare industry here. But today, we really are going to be talking about the incredible Metro Center project that SDSU is bringing to Sioux Falls, which will help educate 400 students annually to prepare them for careers in the medical industry. Our unemployment rate as of November is 2%. And so anything the city of Sioux Falls can do to partner with our higher ed institutions, whether that be SDSU or Augie or USF or DSU, whoever that may be, to fill those jobs is critical. And so with me today, as I mentioned, is President Barry Dunn, and he's going to talk a little bit more about this great project and what it means to Sioux Falls and to our healthcare economy here in this region. So, Barry?
Well, thank you, Mayor TenHaken. I appreciate the opportunity to be here today and talk about SDSU's longstanding, growing partnership with the city of Sioux Falls. It's important to start by reminding everyone that South Dakota State has been educating nurses and pharmacists in Sioux Falls for over 30 years. What's different today is visibility and connection. Until now, those programs have never shared the same space and never been located somewhere central in the city where people could recognize them. And so we're excited about moving these programs together and in the heart of a very vibrant city. The SDSU Metro Center changes our future and Sioux Falls' future in a very big way. We are incredibly proud of the new home we have at 33rd Street and Minnesota Avenue, right in the heart of Sioux Falls. It's ideally located near Avera, Sanford, and the VA Medical Center, and close to many pharmacies. Proximity is important because our students complete their clinical training in these health systems. This building reflects how healthcare education really works, which is integrated, hands-on, and deeply connected to community. Just as important, the Metro Center is a visible invitation to students who may be wondering what's possible for their future. A college degree opens doors not just to a first job, but to a lifelong career with growth, flexibility, and possibility. Having SDSU in this space helps students see themselves in healthcare and understand how a degree can lead to a meaningful job right here at home. The workforce challenges created by COVID were real, especially in healthcare. What's encouraging is that we're seeing strong momentum again. Enrollment in healthcare programs at SDSU and at all the institutions that the mayor mentioned is up. But it's also interesting that South Dakota State graduates more healthcare professionals than any institution in the region. In Sioux Falls alone, this facility will serve students in nursing, pharmacy, respiratory care, medical lab science, and public health. Plus, we have researchers there who work closely with the state and the city of Sioux Falls. Over the next 5 years, those programs in the Metro Center will produce over 1,200 graduates. In total, SDSU will graduate more than 2,500 students with degrees in healthcare professions just in the next few years. Many will stay in Sioux Falls, and as I mentioned to the mayor this morning, most of them want to be in Sioux Falls. Others will serve communities across South Dakota. Either way, these are highly skilled professionals whose education directly strengthens our state's economy and the health systems in our state and the city of Sioux Falls. And even with those numbers, no single university can meet the region's demand alone, as the mayor pointed out. That's why partnerships between cities and health systems and universities and the private sector matter so much. I want to extend a sincere thanks to Avera for donating the building and the land around it for serving as the lead donor on this $19 million project. I also want to thank the many private donors who have made this possible. As a public university, this project is being completed without the use of South Dakota taxpayer dollars. It's a strong example of what can happen when a community invests in education, workforce development. We're also very grateful to Forward Sioux Falls and the Sioux Falls Development Foundation for including the SDSU Metro Center in its workforce initiative. As the Forward Sioux Falls campaign wraps up this spring, we're excited to see how the Sioux Falls business community continues to strengthen this effort. Finally, I want to share with you where we are in the process. Pharmacy and respiratory care students have been learning in the building throughout the remodeling project, but construction is now focused on completing the west side and the front facade, which will wrap up this summer. And this fall, we'll welcome Sioux Falls nursing students into that space. This building represents more than bricks and mortar. It represents opportunity, collaboration, and the lasting value of a college degree for students for Sioux Falls and for South Dakota. With that, I'll open it up for questions.
Are there specific healthcare positions that are more needed than others maybe right now in Sioux Falls, or have you guys seen any of that?
Yeah, it's a great question. In conversation with both of the large systems here in Sioux Falls, but also other healthcare entities, nurses still remain the biggest challenge for them. There was a large drop in enrollment in nursing programs across the United States and here in South Dakota after the pandemic. The images of the pandemic were I think, deterred a lot of students from healthcare fields, but we've rebounded from that, and right now we have excellent interest in all of our healthcare programs, especially nursing.
And then for someone who's maybe getting close to graduating with their degree, you mentioned hopefully they stay here in Sioux Falls or around the region, but what are some of the benefits to pursuing a healthcare degree in this region compared to anywhere else, would you say?
Well, I'm a big fan of South Dakota. I think it's a wonderful place to live, very safe communities for young people, and I think that's very attractive to young people. Lots of young women are nurses, and I think that safety factor versus some other large communities is something to be very proud of in Sioux Falls. So safety, but that vibrant community feel in Sioux Falls, and yet close to home if they come from a rural community. But we have at South Dakota State, we have well over 2,000 students from Minnesota, mostly southern Minnesota, southwestern Minnesota, and a lot of those students want to go to SDSU and then stay in Sioux Falls. So I think Sioux Falls is a big attractor because of its vibrant growth that we've seen over the last 10 years. It's just a very exciting place.
I want to add one thing on that. And I don't know if this would work into your this story or piece or coverage or not, but and I don't have a good source to point you to other than if you go to my LinkedIn profile. I just reposted this yesterday. But Sioux Falls was just ranked by a recent report the #2 mid-sized city in the country for Gen Zers to start their career. And that was based on a variety of factors: the cost of living, job availability, unemployment rate, so there's plenty of jobs, the culture, the environment, things to do. So to President Dunn's point, this is a great place to start your career, whether it's healthcare or otherwise, but the number of healthcare careers that we have and the number of openings we have, between all of our systems, it's north of 1,000 openings we have across the board. So incredible place to start, and I too am biased, but I think it's a pretty great place to live, work, and play. So, all right, any other questions? Okay, thanks for joining us today. Appreciate it.